Okay. Thanks very much, Art, and thank you for having me. So I'll do just two things today in my 20 minutes. So one is to give you an overview of sort of COVID response work we're doing in collaboration with the Bangladesh government and other important implementation actors in Bangladesh like BRAC. And I'll touch briefly upon the collaboration with the World Bank on trying to design a new social protection system. But then what I'd like to focus most of my time on, given the nature of this particular audience, is some between mobility migration and this COVID-19 crisis. It turns out that migrant households are, I think, uniquely at risk here, and I'd like to share some insights that are coming out of our data on the ways in which migrant households are experiencing this crisis differently than non-migrant households. Let me just talk a little bit about migration. Yeah. And those are I'll give you two sets of detailed results and then I'll also. So the summary here, before I get into the details, is that, households, there's some households that are, of course, very remittance dependent, and many such households in South Asia, in Nepal, Bangladesh, places where we're collecting data. And what we observe is that these migrant sending households who are remittance dependent have experienced really sharp declines in their income, even relative to other poorer households that did not have migrants. Okay? And then so that's the economic connection with migration. And the thing that's very clear in the is that returnees, migration return, is strongly associated with COVID symptoms that we document in our data, right? So these guys are also now facing a lot of stigma as a result of this. And then we need to start doing this. We haven't yet been able to document stigma systematically, but that's something that we have a plan to do. Okay? So the implications here are that, I mean, the World Bank itself has issued a report that where you estimate 22% drop in remittances in South Asia. In Bangladesh, observed a year-on-year drop of about 25% already. And these are the households that are remittance dependent, or areas that are remittance dependent, that are worst hit by the pandemic, and we need to ensure that that those are the households that receive some form of protection now. Okay, so the samples, I'm gonna give you a quick fire set of results. The samples come from a work done in partnership with Ifat Sharif and Mahesh Shrestha at the World Bank. Which is a government-to-government visa lottery program. So Malaysia took some Bangladeshi migrants, and the visas were allocated by lottery, right? So we have good identification on who was a migrant household or not. And then a panel survey of refugee households, Rohingya refugee households, as well as host community members surrounding those refugee camps, Rohingya refugee camps. This was also done in partnership with a different team at the World Bank. And then some work that we are doing on seasonal migration and seasonal poverty in Nepal, and this is in western Nepal, both in the hills and in the terrain. Okay, and so here's some basic facts. So one is that this is from the refugee camps, right? There's been a huge drop among refugees and among host communities, huge drops in income. So I'll just point out one fact. So in 2019, when we last talked to them before COVID, 74% of men in Bengalis who were in areas surrounding refugee camps were employed, but that has now dropped to 22%. So there's a huge drop in employment. That's true for the refugees as well. Okay. A second fact is that remittance income has declined for migrant sending households. So this is data we just collected after the lockdown in April in Nepal. So this is what remittances look like in this sample that we have been following around month by month. Okay. So this is the variation in remittances. It is seasonal, and here is the situation post-lockdown. And why has this dropped? One reason is that many migrants were forced to return, right? So this is, migration is seasonal here. People go to India, people go to cities in Nepal. So you see this is a very seasonal variation migration. People are away before the harvest during the lean period of the agricultural season, pre-harvest. They come back during the harvest and for the festival, right? So this is how migration varies, and this is what the migration rate is after the lockdown. Right? So one is that people have been forced to return from India and Nepal, and the second one is that even the set of people who are away. So this is what over time the remittances per adult male away looks like, right? It doesn't vary all that much. How much money people send? Close to 4,000 rupees. Okay, and this is what it looks like now. So even the people who are away are sending a lot less money back. Okay. And then now the sample of international migrants, and And here, um, this is the Bangladesh Malaysia visa lottery program I had alluded to, right? So it turns out that lottery winners, so I'll give you the bottom line number, which is that lottery winners were earning about 18% more in 2019 than lottery losers, and the lottery happened in 2013. And the reason they earn 18% more is that we observe in our data that they are much more likely to be international migrants and they have much higher remittance income. Okay? They had an 18% premium on non-lottery losers. And then right now in April 2020, when we surveyed them again, there's been a complete reversal where lottery winners are now 36% less likely, or have 36% less income than the lottery losers, right? In other words, migrant families or high likelihood migrant families have lower income now than low likelihood migrant families, and this is a reversal of the ranking. Okay? And you see that over 10% of lottery winners are saying they have no income whatsoever, but only 6% of lottery losers. Okay? And another fact that comes from the Rohingya areas, the Cox's Bazar district, Rohingyas and Bengalis, is that many people report symptoms and that's true for multiple samples. But most importantly, something that's not shown in the graph, but it's down here, is that if you're a person who is in a community that reports having a recent migrant returnee in the last 2 weeks, right, then your odds of reporting COVID symptoms, like WHO, CDC COVID symptoms, your odds basically triple relative to the set of people who don't have migrant returnees. So migration seems to be a really important vector that's already showing up in the data. Right? And you can imagine that this is going to lead to a lot of stigma as well. Right? Okay, so fine. Okay, so this is what I'll do with my remaining couple of minutes. So now that there's these strong links between migration and COVID symptoms, right? Can we actually use that to make some predictions and predictive policy prescriptions? Okay, so the idea here is I'm going to give you a very simple idea, and then I'll show you the maps that get produced on that basis. So since migration spreads, since the disease spreads by human-to-human transmission, right, the areas that are migrant sending are likely to be more at risk. Okay? So that means that I can actually, if I can link every sub-district in Bangladesh to Italy, Singapore, places where the disease emerged early, right? Then I can create kind of a heat map that gives you a risk exposure index for every sub-district in Bangladesh. Okay? And so that's what we ended up doing, and these are the maps that get produced. And hopefully, this is we shared it with the government, and it gives you some sense of what are the areas where the disease is likely to be present, where you need to pay a bit more attention. And also, these are the areas that are going to experience the sharpest drop in remittances. Okay? And so that's the outcome of our predictive model. How well does it do? Right? So we can basically look at our prediction, which is in the x-axis, against some actual data, like quarantines, right? The fact that it matches with quarantines, it maybe is not such a surprise because the quarantine decision is partly dependent on, what we track in our data, which is, are there returnees, recent migrant returnees, okay? And because the government is also paying attention to that. But what's even more interesting is that the government hotline where you can make distress calls, and we've now gotten the data from the telecom service providers on exactly where the calls are coming from, and that matches really well with our sort of exposure index constructed on the basis of migration. And so basically what I'm saying is that we make some predictions and it gets validated by some actual data. That's true for Bangladesh. We use a lot of different data sources in Bangladesh. In Philippines, we tried it out as well, and you get a map at the municipality level. You could do it at the province level, and it also matches well with actual testing data that the government is reporting on a website. And importantly, I just want to say that in doing this work in Bangladesh, we used many different data sources. So we used the data on airport returnees, the disembarkation card data from the Civil Aviation Authority. We used data on migration permits handed out in the last 10 years from another government administrative records. And third, we even use HIES, the LSMS style survey that the Bangladesh Bureau of Statistics does, and even that actually has predictive power. And I mention this because if LSMS style surveys have predictive power, that means that you can do this exercise for many different countries. Okay. Okay, and then not only can you do this exercise sub-nationally, right? You can also validate by international case data because you can apply the same concept, which is let's look at the link of Senegal versus Egypt versus Niger versus Nigeria to international migration links to countries like Italy versus France versus Spain versus China or South Korea, right? And then that also creates a prediction at the national level, which is on the x-axis, and it gets validated pretty well with the actual cases and actual deaths. Right? This the second one should be deaths, and that allows you to construct these types of indices at the international level. Okay, so let me stop there. Happy to take questions.